Are you new to diabetes? Do you want to learn something about this condition? Hi, I'm Dr. Isabel from Mydoctordiabetes. I am an internal medicine doctor and diabetes specialist, and I have been managing patients with diabetes for over 20 years now. I am very passionate with what I do, and I am a true believer that patients with diabetes should know and learn about their condition because it impacts the outcomes. Diabetes has a lot to do with daily decisions, so it's really important that you understand and make the right decisions. Just to clarify, this video is about diabetes mellitus. It's not about diabetes insipidus, which is a completely different disease. So let's start by the very basic, maybe too basic. What is diabetes? Diabetes is a syndrome characterized by chronic hyperglycemia. So what this means, it's a condition that can be produced by different causes, that's why it's a syndrome, and that it produces levels of glucose that are higher than normal in a chronic fashion. So depending on the cause of diabetes, the cause that leads to high blood sugar, you can classify diabetes into four groups. We have type 1 diabetes, which is about 10% of the diabetes population, and this is produced by an autoimmune dysregulation that targets the beta cells of the pancreas. The beta cells are the ones that produce insulin, and they get destroyed by this autoimmune response. So insulin production starts to decrease until a point that you get hyperglycemia, and eventually you get zero production of insulin, and you need to get insulin shots on a daily basis to manage your glucose metabolism. So that is type 1 diabetes. There are markers that can help you diagnose. However, there's a very small group of patients that have negative markers, and they're still classified as type 1 diabetes. Then we have type 2 diabetes, and this is by far the most common type. It's about 90% of the diabetes population. And what happens here is a mix because there is, on one hand, insulin resistance, and on the other hand, a diminished insulin production. So insulin resistant means that the hormone insulin, is not able to bind to its receptors very effectively, and the response of the tissues are not as effective. So glucose is not able to go into the tissues, and it stays at higher levels in your bloodstream. Why insulin resistance happens? Because of different things, genetics, but mainly also overweight and sedentary lifestyle. Those are the most common causes. On the other hand, we have the pancreas. At first, the pancreas senses that the insulin is not being very productive, that there is insulin resistance. So it increases the production of insulin. The beta cells are able to overcome this resistance by an overproduction of insulin. And you can actually measure insulin, and it can be high in these patients. However, at some point, the pancreas is not able to overcome the resistance, and hyperglycemia, high levels of glucose, develop. So that's type 2 diabetes, a mixture of insulin resistance and a lack of overproduction necessary to compensate that insulin resistance. Then we have other types of diabetes, and there is a mix here. So you can have diabetes because there is a pancreatic issue like cystic fibrosis or some other pancreatic diseases like a severe pancreatitis. You can have chemicals and some drugs that may induce diabetes. There's also monogenic mutations in certain genes that patients can develop diabetes. They are very rare, they are hard to diagnose, they require genetic testing. And that would be the third group of diabetes. And the fourth one is gestational diabetes. And this is the diabetes, the hyperglycemia that occurs during a pregnancy, during the second and third term of the pregnancy, because an imbalance of the hormones secreted mainly because of the placental hormones. I want to mention another type of diabetes that you might have heard, which is LADA, latent autoimmune diabetes of the adult. This diabetes is an autoimmune condition that leads to hyperglycemia, but what is different about the type 1 diabetes is that it usually occurs at older ages and the onset is less abrupt. However, the American Diabetes Association considers LADA as an autoimmune disease, therefore as a type 1 diabetes. You might have heard in social media type 3 diabetes. I just want to make sure that you understand that this is not a real diabetes classification. It's not recognized as such by the American Diabetes Association. And it's mainly about Alzheimer's disease that has been linked to metabolic conditions and brain insulin resistance, but it's not a real diabetes classification. So in this video, we talked about what diabetes is, about its causes and classifications. I will be posting more videos so you can understand about this condition and so you can learn diabetes with My Doctor Diabetes.